It is 8:30 a.m. at the department, and Mrs. Tremblay is in precautionary isolation. She rings because she wants to get a drink of water, but is unable to get out of bed due to her surgery. You are required to wear personal protection equipment before you enter and then dispose of it afterwards.
Personal protection equipment protects the personnel and other users against transmissible infections from infected patients. These measures must be followed at all times and by all personnel. The potential paths of contamination are physical contact, aerial contact, droplets, or vector, transfer of an infectious agent through a contaminated source such as clothing. The use of proper protection equipment prevents contamination of the hands and clothing and or coming into contact with biological fluids that could contaminate other personnel and or users. Also, protection equipment can be implemented to protect a vulnerable user, in which case the latter is protected against potential microorganisms from outside. The PSW consults the required isolation measures posted at the entrance to the room, which can vary from one user to the next and must meet current standards. The following measures may be posted: procedural or N95 mask, gloves, gown, and eye protection. In some cases, a dedicated room and materials may be required. If in doubt, the PSW should ask the nursing team. She must prepare all her materials prior to entering the room, since once inside, she may not leave it again without removing all her personal protection equipment and performing hand hygiene. The PSW performs hand hygiene to minimize potential pathogen transmission. Refer to the hand hygiene training module for standard procedure. She puts on a clean gown, making sure it does not touch any potential contaminating surfaces, the floor, counter, etc. If the gown gets wet prior to entering the room, it must be replaced with a new one. Tying the gown at the neck and waist secures it in place and prevents contamination of partially uncovered clothing. The PSW's hair must be tied back at all times. The PSW takes a mask and adjusts it to her face. She takes it from the top and secures the metal strip across the nose to ensure tightness against entering or exiting droplets. She places the elastics behind her head and unfolds the rest of the mask under the chin for maximum protection. At times, situations require the use of protective glasses or visors. They are added at this point in the sequence if necessary. She performs hand hygiene before selecting proper size gloves and demonstrates how to fit them to provide best possible dexterity and comfort. The PSW takes a first glove from the box. She holds the glove between her thumb and index at the wrist and slides her other hand inside. Then, she adjusts the glove at the wrist and fingers. This method helps to easily slide the hand into the glove. It is also important to note that dry hands slide into the glove more easily. She then adjusts the glove around the fingers and at the wrist over the gown's sleeve. This is repeated for the second glove. It is important for personnel to find out how the user is reacting to isolation and also how she is doing, as this may cause duress in some people. With this exchange, the PSW encourages the patient to voice her concerns or fears.
Oh, I understand, dear, why I'm put in isolation. The nurse explained it to me. It's important that I don't contaminate anybody else, huh?
Perfect. Yes.
Thank you.
Having finished assisting the user, the PSW remains in the room and removes her personal protection equipment. Important: if the gown is tied in front, it must be untied before removing the gloves, as it is considered as contaminated. The PSW removes her gloves as follows. She pinches the glove at the center of the palm, being careful not to touch any skin, and pulls it off, turning it inside out. She keeps the soiled glove in her closed hand. Then, she places her index and middle fingers inside the second glove, just inside the wrist, and pulls it off, turning it inside out. She then discards the gloves safely. This method limits the risk of hand contamination when removing soiled gloves. After removing the gloves, the PSW washes her hands with hydroalcoholic solution. The PSW removes her gown as follows. She unties the drawstring at the back and neck, frees her shoulders, and lets the gown drop along her arms. If it does not slide down, she can use her hands on the inside of the gown to avoid touching the contaminated outside surface. The PSW folds the sleeves against each other, inside over outside, holding the gown away from her body to avoid contaminating her clothing through contact with the soiled garment. She places the soiled gown in the appropriate color-coded bag. She then washes her hands with hydroalcoholic solution. The PSW exits the room and removes her ocular protection and mask as follows. She takes off her ocular protection and throws it away in the waste receptacle. She then leans forward slightly and removes the elastics from behind her head. She places the mask in the waste receptacle. She then washes her hands with hydroalcoholic solution. In the case of contact isolation, the hands must be washed thoroughly with soap and water to remove any spores.